All right. Thank you all so much for joining us this evening. I'm pretty sure we have some exciting information for you that hopefully you will find beneficial for you personally. We have two of our specialists that are dynamic in the urology space, and they are going to be presenting to you tonight. They are both a part of the Orange County Urology Associates, Dr. Nakamura and Dr. Shoureshi, provide an experience and a compassionate care that makes them experts in the field of urology. So at this time, I'd like to turn it over to our physicians and they can further give us information about themselves that'll give you some insight into how they're able to help in the patients that they treat. So doctors, it's completely up to you now. Thank you.
Okay. Hi, everyone. I'm Dr. Leah Nakamura. Thank you again for taking the time to join us tonight. I hope you'll get something out of this presentation. So I've been with Orange County Urology now for about 10 years. I am a board certified urologist and also certified in urogynecology and pelvic reconstructive surgery. I have been doing sacral neuromodulation during that time and even longer during training. And I think it's a great therapy. And my specialty and my passion is taking care of patients with bladder bowel issues and pelvic health issues. I'll let Dr. Shoureshi introduce herself.
I'm Shoureshi. I similarly to Dr. Nakamura, I'm trained in urology, but certified in female pelvic medicine, reconstructive urology, and also specialize in treating patients who have overactive bladder, bowel symptoms. And so hopefully this will be an educational webinar for everybody.
And we're gonna kind of split it up. So I'm gonna take the first half, and then Dr. Shoureshi will take the second half, and then we'll be available for questions at the very end. So we will skip along on the slides, and hopefully everyone can see everything. So this is just a welcome from us. And so just to start, I'm sure most of you are here because you ask yourself these questions, all the time, that your bladder and your bowel sometimes run your entire life. You're afraid to leave the house, afraid to wear, any light colored pants because of having an accident, always feeling like you need a just in case type of pad. And the thing about this, it's not just you. I mean, it's actually a pretty common theme that we hear, from a lot of our patients. 48% of people with overactive bladder, they have problems with their sensation of confidence and getting on with their normal activities of daily living. And a lot of them don't feel like their symptoms are being managed appropriately. So the reason for this webinar is for everyone to kind of hear your options and think about, what you can do to help make a change. That everybody thinks, okay, this is just happening to me because I'm getting older. I mean, it is true to some degree that the older you get, these problems become more common, but it doesn't happen to everyone. It's not quote unquote inevitable. And it's not something that you necessarily have to live with. So, some of the things that, if this sounds familiar to you, like we talked about, having to wear pads, getting up multiple times a night, planning everything around the bathroom, and having that gotta go feeling, it means that there is, something that is off and can be changed. I think we talked about this already. You're not alone. 1 in 6 have bladder control problems. 1 in 12 have bowel control problems. And it affects not just older patients, it affects young patients as well. And it will affect your overall health because it can cause problems like loss of sleep, loss of confidence, just poor feelings on your whole general health, really from sleep and not being able to do the things that you want to do, exercise, etc. So it definitely is a major source of not just, the bowel and the bladder, but everything else. So the good news is that there are other treatments. It's not just a pill. It's not just, live with it, that can help you get your life back in more control. So we're going to talk a little bit about, what causes some of these bladder and bowel control problems. There is some contribution from what we do on a day-to-day basis, things that we eat and drink, things that are more irritating to the bladder, like caffeinated beverages, sometimes spicy foods or, acidic foods. Certain medications too will make you more prone to having, especially on the bowel side, things that cause more diarrhea may cause more bowel control problems. Certain supplements can irritate the bladder as well, and medicines can irritate the bladder. A lot of people take diuretics that make them, have a high amount of volume that's difficult to control. And then just life events in general make it hard for us to have a handle on our bladder and bowel control. So, pregnancies that women go through, delivering those babies, and any kind of injury that happens, whether it was from that delivery or from something that related to another pelvic surgery, those are all things that can lead to bladder and bowel control problems. And to some degree, a lot of this bowel and bladder control is not necessarily related to anatomy. A lot of it has to do with how the brain, talks to the bladder and the bowel. And so anything with those nerve signals, which come up from the brain, travel through the entire spinal cord and all the way down to the bladder, any interruption of how those signals are communicating with each other can indeed, lead to bladder and bowel control issues. And so this stimulator, which we're eventually going to talk to about, one of the way that it works and helps from this degree is that it stimulates those nerves that are down there, directly innervating into your bladder and your bowel. And by doing that, it helps to regulate all those nerve signals that come from the brain down to get better control. So what are some of the bladder and bowel control problems that we encounter? There's actually several different categories. So on the bladder side, we oftentimes break down bladder issues into 3 categories, or really even 4 categories. So there's stress incontinence, which is kind of more a coughing, laughing, sneezing type of leaking, more common after having babies. There's retention, which we'll go over in detail, overactive bladder, and sometimes a combination of all 3 things that can happen all at once. So that's on the bladder side. And on the bowel side, there is fecal incontinence, where actually loss of control over the bowels. So I kind of alluded to this a little bit earlier. What's stress incontinence? So that's that leaking when you sneeze, cough, laugh, exercise. You make a sudden movement, you climb stairs. It's more of an activity-induced type of leaking. That is stress incontinence. And this therapy that we're talking about tonight does not really help much with that type of stress incontinence. This is more of a support type issue and muscle issue than a nerve issue most of the time. What is retention? So retention is when you're not able to empty your bladder all the way, or in some cases, you're only emptying your bladder to a small amount. Sometimes you have leaking with retention, where you're in what we call overflow. So like a cup that's too full spills over the top, and you end up having leaking secondary to retention. This kind of urinary condition is a little bit complicated. In some cases, the retention is actually from obstruction, either from something like scar tissue, or in men, prostates oftentimes cause retention when the prostate grows and gets too big. So in the setting of obstruction or blockage causing that inability for somebody to empty their bladder, this type of therapy does not work as well. Retention that's not necessarily related to obstruction, or sort of what we call quote unquote an idiopathic, or there's not really a reason, and it seems to be more neurogenic in some cases, can actually be controlled with the Medtronic bladder therapy. And then finally, this is kind of our big condition that we're focusing on tonight, this overactive bladder, the gotta go, type of sensation. So urge incontinence is that type of leaking that happens when you have the urge to go and you can't quite make it to the bathroom in time. Some people even, they get that episode when the temperature changes, or when you turn the faucet on, or even turn the key in the lock when you come home, you drink a little bit of liquid, and then that brain sends that signal down to that bladder, and you just can't hold it back. And that's what results in this urge incontinence. And with this overactive bladder syndrome, in addition to the urgent incontinence, it often comes with urgency and frequency, meaning that you got to go to the bathroom all the time, waking up several times a night, feeling like you keep on having to go even after you went. So that's where that urgency and frequency syndrome that goes along with overactive bladder. And then finally, the fecal incontinence. So this is, it kind of breaks down into two different types. Urgency, where you may feel like I gotta have a bowel movement, you can't quite make it in time, and you have an accident. And then even passive incontinence, where you have the inability to feel when you actually need to go, and you might have an accident. So this can be very devastating for patients when we're troubled with a condition like fecal incontinence, because it's a very embarrassing thing, and present with things like having to change your clothes often, and wear pads for this. So but this type of therapy also can help with this fecal incontinence as well. So I'm going to turn it over to Dr. Shoureshi.
Thank you for that lovely background. So I'm going to talk a little bit more about the specific ways that we can treat incontinence, both our bladder and bowel symptoms. So number one, we'll talk about some lifestyle changes, medications, and other advanced therapies. So first off, I'm sure if you've seen any of us in clinic, we've talked to you about this. Simple ways that you can try to control your bladder and bowel symptoms are simply adjusting your diet. Dr. Nakamura alluded to certain things like fluid intake. There are certain bladder irritants and bowel irritants in our food, such as spicy, acidic, carbonation. Some people are more sensitive to those than others. Exercise can certainly help with these symptoms. And then there's also biofeedback. So retraining both your bladder and your bowel to not have to go as often. Some patients will even recommend pelvic floor physical therapy, again, to help strengthen those muscles, and also work on some behavioral therapy to retrain ourselves and how we respond to signals to go to the bathroom. And no matter who you are, everybody benefits from pelvic floor strengthening, or Kegels. I know there's a lot of confusion about what is a Kegel. How do you perform a Kegel? So the best way is, imagine yourself trying to stop yourself from passing gas. You're squeezing all of those inner muscles in your pelvis. That's the best way to perform a Kegel. Now, oral medications for bladder. So medications essentially work to relax the bladder muscle so that we don't feel that need to go to the bathroom as often. They usually you have to take them once or twice a day. Depending on which medication works best for you, it can be quite expensive. And some of the most common side effects of medications include dry mouth, constipation, blurry vision, high blood pressure. In one survey, they even found that up to 72% of people stop taking their bladder medications within 6 months of being prescribed it. And so it's really hard for some people to take a medication every day. And that's why we'll give you some more detail about the advanced therapies. Additionally, a lot of the reason behind why people stop the medications is they either didn't like the side effects or it just didn't work for them. So some of the advanced therapies that we'll talk about are the InterStim, or the bladder pacemaker, the neurosystem, and injected medications. Those three can be used for bladder control and for the bowel symptoms of urgency, fecal urgency, I gotta go, I'm not gonna make it in time. We'll talk about that pacemaker and some other surgical options. So Botox injections. These can be used to temporarily treat overactive bladder. Similar to how medications work to relax the bladder muscle, well, Botox is the ultimate muscle relaxant. So we actually inject it into the bladder approximately every 6 months. And the effectiveness is considered to be comparable to oral medications. However, as we alluded to, the bladder pacemaker, or the bowel pacemaker, actually works on that bladder-brain communication to reprogram some of those nerves. Botox doesn't do that. It only works on actually paralyzing the bladder muscle. And the two main risks of Botox are, of course, an infection with the procedure and the potential need to self-catheterize if the procedure works a little too well. And one study even found that up to 67% of patients discontinued their Botox treatment just after the first injection. So the neurosystem. So interestingly enough, the nerves of our bladder actually end in our foot, in what's called the posterior tibial nerve. So for some patients who aren't ready to quite take the leap into more invasive therapy or are unhappy with medication, the neurosystem is a great treatment option. It's essentially like an acupuncture needle that we put just above the ankle. And as you can see in the photo, you sit with your leg up for 30 minutes. And you do this in our office once a week for 12 weeks. And then ultimately you spread out those sessions, so you just have to come back once a month. It's a great non-invasive option for somebody who has bothersome symptoms, but again, is not interested in taking medications and is not interested in the pacemaker therapy. And finally, sacral neuromodulation. So this essentially works to correct the communication pathway between the brain and the bowel and the bladder to help restore you back to normal function. And what we have found is that the Medtronic bladder control therapy is in fact more effective than medication. And for this therapy, we don't jump to putting an implant in anybody. First, we usually will do a test trial actually in the clinic where we'll place two very thin wires in the low back. And for 1 week, you'll wear a battery with a belt, and you'll see if it's even the right option for you. And we define success as greater than 50% or greater reduction in your symptoms. And as I said, here's a photo of what it looks like to have the belt. And as you can see, the patient's holding a cell phone, which we will give you and teach you how to use to adjust the settings for the therapy. And after you've had that trial for 1 week, we see you back in clinic, and then we talk in more detail about how did you do? Did you like it? Did you notice enough improvement? And then the beauty of the pacemaker therapy is that if you want to use it, there's a specific app that can give you more personalized information, help you track your symptoms, and walk you through videos and educational content to help you use the system to best fit your needs. And lots of people like to ask, with the pacemaker, you will not set off detectors at the airport, and it is in fact MRI compatible. So there's even like an MRI setting on the device that you can then turn it off when you need to get an MRI. As you know, a lot of patients are sometimes older, they may need brain or spine MRIs, and it is fully safe to get those MRIs with the pacemaker in place. So the Medtronic bladder and bowel control therapy is a great option if you think you have really bothersome symptoms, you've tried those lifestyle changes that we talked about, you've tried medications, and they haven't quite given you the relief that you want. In my mind, if your symptoms are inhibiting you from living your daily life and doing the things that you want to do, then it's time to do something about it. So just some statistics, 84% of people are satisfied who use their device. They report 3 times greater improvement in quality of life compared to medications. As we discussed, a large percentage of people will stop medicine. And 89% of patients have experienced long-term success. And over 400,000 of these have been implanted over the last 25 years. Patients often ask me, is this a new technology? No, it's not. It's been around for a long time, and it's had a lot of success. And see if it goes into it, the other slide. But something else to think about is the battery for the therapy, depending on your amount of usage, it can be good for about 10 to 15 years. So ideally, this will be a nice long-term option for many patients. And if you are ever interested, we can give you the number for patient ambassadors that you can actually speak to them directly to hear more about their story and to hear about their journey. And that's it from us, and we'll turn it back over to Kenya.
Thank you guys so very much. That was so informative. I hope that our participants were able to grasp the information that you're providing for them. And if by chance there's some questions that they have, we now have a question and answer period. So if you do have a question, go ahead and put it into the chat that's located at the bottom of your screen, and we will direct those questions to our providers to answer for you. But in the meantime, while we're waiting for that, please keep in mind that the way to make an appointment is on the screen for you at this time. It is the Orange County Urology Associates. Both doctors' names are there and their phone number is there. In addition to that, I am about to launch another poll. And if you can be so kind as to fill that second poll out for us, we would greatly appreciate it. Just a few questions that are on there for you. If you want to have a conversation or talk with someone that actually has had the therapy device and have been utilizing it and living with it for quite some time, we have an InterStem Ambassador program, and that is located on your screen. You'll see that in the far right-hand side of the screen. If you go to the website, InterStemAmbassador.com, you can sign up for an opportunity to talk with individuals that have or may have been struggling, if you are as well, and they're able to talk to you about their experience. It's nothing more informative than talking with someone who actually can relate to what you may be going through as well. So at this time, I do want to take an opportunity to pose the questions to our providers since they are here. It's a perfect opportunity for you to ask as many questions as you would like. So if you want to do so, please put those in the chat. So doctors, if you're ready, the first question I have for you is the device surgically implanted, or where is it implanted?
So the actual device is, it is surgically implanted. So the trial that we talked about, we can do it in the clinic. You don't necessarily need anesthesia or anything. We just use some local numbing. But if you have that greater than 50% improvement in your symptoms and you would like the actual implant, we do place that in the operating room. We can do it with like a light sedation, like how you get a colonoscopy. And it's implanted just above your bum, in that fat pad of your bum. So nobody has to know it's there. It's completely under the skin. There is one larger incision that's a few centimeters long, but that's about it. And then the big thing is, after you do get the device implanted, no big bending, twisting activities for a few weeks after surgery.
I just saw another thing pop up on the chat. There's a very, very low risk of infection. Of course, any implant has a small risk, but it's overall, very, very low in this case. So, side effects and potential downsides of having that implant are pretty low overall. Small risk of it migrating or kind of moving, and very small risk of developing pain later. But overall, it's a very minor surgery, very easy surgery to go through. And and again, like Dr. Shoureshi had said, the great thing is that you get an easy test before that with that little percutaneous leads that go just above that tailbone area.
And something to keep in mind is that placing the device, it's not a complicated procedure. The reason it's done in the OR is because it has to be a sterile environment to reduce that infection risk.
Thank you. So before we move on to the next questions, I want to live in this space for just a little bit, because in my time in doing these webinars, there's been some questions that individuals have about the pain associated with the procedure. And I know you did mention that there's no twisting and bending. How soon afterward are they able to return to normal activities, or are there things that they should refrain from doing once they've had the implant?
So for me, Dr. Nakamura might be a little different. I don't know. We'll find out. For me, usually what I tell my patients is no big bending, twisting motions for at least 1 month, preferably 6 weeks after surgery. And then you can shower after surgery, but no hot tubs, baths, soaking, saunas, anything that covers the incision for that full 6 weeks after surgery until everything has fully healed.
I'm a little more forgiving, so I make them wait a couple of weeks. Honestly, the great thing about the permanent lead is that it does have some what we call tines, kind of almost like a fishing hook, so that it kind of stays in place. When you're going through that first percutaneous or like the very temporary leads, you have to be very mindful during that time because those leads can easily move. But once the implant is in, excuse me, it's about healing, so you got to give yourself a little bit of time to heal. So, but really, I mean, after a couple weeks,
Yeah. I mean, and after surgery, most people do fine with Tylenol, ibuprofen. You can go back to your regular job pretty soon after surgery. If you feel comfortable, you can drive. There's really not that much activity restriction. It's just those initial few weeks to allow everything to heal into place.
Thank you. So I want to move on to a question, and I'm very excited to see it. It says, for a teen, will the neural work for nighttime loss of control? And I just want to live there. If you can speak on the fact that this device, this pacemaker, this implant is not specifically for a particular age group, that it is a range of individuals that find themselves utilizing and needing this particular device that Medtronic has. So could you speak about the age focus, as well as answering the question for if it's a teen and they have neural, will it work for nighttime loss of control?
Okay. So nighttime loss of control, especially in younger patients, it is a little bit more complicated than just your typical sort of overactive bladder. So that's a situation we call nocturnal enuresis. So, in our younger patients, it's not out of the question to try a therapy like this. I will say that right off the bat, especially if traditional treatments for nocturnal enuresis have failed, which include medications typically like desmopressin, then absolutely it is something to consider. I mean, the nice thing about that type of therapy for a younger person is that there is not a permanent implant, and it is a temporary, very minimally invasive, low risk therapy. And so it is not out of the question to try something like that posterior tibial nerve stimulation.
Yeah.
Thank you. So I guess we need to spend a little bit more time talking about the implant itself and where it actually is implanted, where the probe's inserted. Is it into the spine, or are there nerves affected by the device itself? So can you speak a little bit more about after you've done the test and what the implant actually looks like and what that entails?
Maybe we should just show it to them on my back. That might be the easiest. That might be the easiest thing. So I'll be the monitor for Dr. Shoureshi.
Okay, so we have middle of the spine, low back, right, your sacrum. That's where you sit, and it's implanted on either side. So there's one spot just lateral to the midline is where the lead will go in, and then it actually will sit next to the nerves that control the bladder, and then the battery is placed kind of in that bum area. And I think a lot of people have questions about what if I've had back surgery, lumbar fusion, etc. Those are not contraindications. And in fact, most of people's spine surgeries or back issues that they've had are actually at a different spinal level than where this pacemaker is placed. And so it's very rare to find a patient who cannot get this placed. And then aside is I also have patients who have like heart pacemakers or pain pacemakers, pain pumps, and it's okay to also place the implant adjacent to those.
And then the size of it, I mean, depending on which one you do. I mean, the recharge is a very skinny, small thing, about the size of like a very small thumb drive. And then the non-recharge, also pretty small. I would say probably about
it's like a few centimeters.
Yeah, so tiny device overall, and very flat, so that you don't feel it.
And then if you ever have questions about, honestly, we have examples in clinic that we can show you. We have samples of the 2 different types of batteries, and we can give you more images about what's going on.
Thank you. So we have all used the word pacemaker, and someone is asking, does it work somewhat the same as a heart pacemaker? So can we speak a little bit more about that for clarity?
So I think we use the term pacemaker just to make it a little more simple to understand. It doesn't like set certain beats, but basically all it's doing is sending constant impulses to the nerves to help relax the nerves and work to that communication between your brain and bladder. To be honest, we don't know exactly how it does that, but it's just sending a constant stimulation. And one point of clarification is this pacemaker, the inner stim, again, 24/7 stimulation versus that neuro treatment that we do in the clinic. You are only getting stimulation for those 30 minutes at a time for each treatment.
And this quote unquote like pacemaker, I mean, it's always kind of chronically sort of like, you know, on and stimulating. And by doing that, I mean, one of the theories is like almost like a reflex type of a reflex arc that goes up to the brain and then sending more inhibitory signals down to the bladder. So it's not like, oh, I have to push my button on my
Yeah.
pacemaker to make it activate,
Yeah.
or push my button to make me pee.
And you'll still have those normal urges of when do I need to go to the bathroom. It doesn't tell you to do that. You still have those same regular reflexes to do that. And also there's no like pain associated with it. You're not constantly feeling it. Some people ask that.
Thank you. I want to go back to a question that was sitting here for a little bit of time, and to the best of your ability to be able to answer it. It says they suffer from heart constipation. I'm using milk of magnesia, Delcolax, and magnesium citrate. What can I do to have a regular bowel movement? And I know you guys are in a different workspace in regards to dealing with incontinence, but if you can give them some direction on this, it would be greatly appreciated.
So I can take this.
Sure.
This therapy is not, you know, aimed to like treat constipation. The therapy is aimed to treat more urgency and incontinence, so loss of control of the bowels, rather than actually, you know, stimulating the bowels to go. Constipation is a very challenging, you know, thing. There's so many factors that play into about you know, managing constipation. It sounds like you're doing a lot of good things. I mean, if you have not had care yet or had an evaluation with a gastroenterologist and you've tried everything, that's probably your next move, because you need to make sure there's nothing anatomic going on, and they have other, you know, medications that could help with like constipation once you've failed all, you know, like you said, your fiber, your hydration, your diet, eating things that, you know, do help, you know, your bowels to go regularly. So those are your first factors. And then after that, it could be something, you know, again, you know, related just to your motility of your bowel, and but could also be something anatomic. So an evaluation with a gastroenterologist is your next best step.
Okay, I know the questions. I know the answer to the next question, but if you can tell them, they want to know if insurance covers this.
Yes, it does. In fact, I've had some people who will do these alternative therapies because it's actually cheaper than paying for their medications every month.
Perfect.
But it is, oh, sorry, but it is important. And I think I saw this in another question too. So, you know, that 50% improvement, you know, that when you're going through that trial, that is an important part of, you know, making sure that it is the right therapy for you. And sometimes for a lot of insurance companies, they want to see that improvement. So doing diaries to document that improvement from your baseline to when you go through the trial is important, to get your, you know, ensure that your insurance will cover the therapy.
Thank you. And so there's a question that says, I heard that Kegels are appropriate for only certain types of incontinence. Can you elaborate on that for us?
I mean, I can take that one too. So, not necessarily true. Kegels are not a one-stop shop to fix every single. I would completely agree with that. However, Kegels will help both with that stress incontinence, so that coughing, sneezing, laughing, exercise type leaking, but it also helps with the urgency and the overactive bladder leaking. So, in that particular case, Kegels are appropriate. Now, where they are not are in cases where, some of the leaking or pelvic problems could be from, a tense pelvic floor or pelvic pain. Those are when Kegels may not necessarily, be an appropriate thing to do. So, but in general, Kegels can help, both with this urgency, overactive bladder, and stress incontinence.
Thank you. I'm going to read the question as it's put on the screen, and I hope you can pick up as to what they really are asking. It says, for IC of bladder, is any of the 3 items recommended?
So there is good off-label indication for the bladder pacemaker for patients with IC. Yes.
But I would say if it depends, because IC is such a big category. I will say that. So that bladder pain syndrome, interstitial cystitis, it can have a multitude of different symptoms that a person has. So I personally, and this is just a personal thing, for my patients with IC, I would direct them to therapy like this if the predominance of their symptoms is mostly around frequency and urgency, or even some leaking. Now, if it's all just pain itself, you may not get as great of a response and a resolution of the symptoms you're looking at for IC. But if it's predominantly frequency and urgency, then yes, that can be a benefit.
Thank you. Next question. If PTNS did not work, would I be less likely to benefit from InterStim?
No, I think it's still a good option to try. PTNS is in general not as successful as the InterStim, and you're targeting this tiny little nerve above your ankle that in everybody can be in a different location, hard to target, and some people have less sensitive nerves than others when you get down to the foot, whereas with the InterStim, you're actually targeting the nerve right where it comes out of the spinal cord, the nerve root. So you're much more likely to have a successful outcome. But again, then that's why we do the office trial. Then you'll know. We don't commit to putting in a device until we've done the test.
Thank you. And next question is, how do you quantify the improvement rate? What percentage do you feel that there is improvement?
Say that
again?
They want to know, what do you feel the percentage of improvement is for individuals that do the InterStim?
Oh, it will vary. I mean, I'll say, on average, I think when you look at statistics, it's around the range of 70 to 80%. And so, and there are, a smaller percentage of patients who are 100% or completely, dry or relieved of all their symptoms. But degree of improvement, we're looking at, patients needing at least 50%, improvement rate. So I'm not sure if this question is asking how do patients feel improved percentage wise, or how many percentage of patients end up with a successful trial and end up going on to therapy. So I'm not sure what we're looking at. But if we're looking at how are patients doing after the therapy, I think overall, I would say it's about, a 70 to 80%, overall.
Majority are happy.
Yeah.
And then
So it leads into the next question that says, how soon after the surgery will one see improvement?
right away.
You should start feeling improvement, but you may need to be adjusted. For sure. But yes, this is why that first trial period is only about a week. But it may not be okay, slam dunk, as soon as you get the implant in, the next day you're going to feel great. So there could be an adjustment period where you might have to put the right program in. But yeah, patients should feel, improvement within a month after having the implant put in.
And I think something important to consider is bowel and bladder symptoms change with time. So whatever you start with, you might continue to have to make adjustments with time. That's why it comes with that little cell phone that you adjust the settings.
Thank you. So I am going to make a few statements beforehand, but if you two would like to give any closing statements or encouragements to the participants that are online, what would that be?
Oh no. I was just gonna say thank you so much for spending your evening with us. I hope this was informative. The reason that we even put in the time to do this is we've had a lot of success with this and we want more people to be aware of it. And please contact us. Let us know if you have any questions. We're happy to talk about it with you more in detail in person.
I would second that. Thanks for giving us your time tonight, and I hope you did get something out of it. And if there is any interest, I mean, definitely direct yourselves towards the website because I think it's a very helpful source of information about the therapy and actually about just treatment for this condition in general. And yeah, please, I agree. We're both very passionate about treating and helping patients. This is why we got into this and why we're subspecialized in this. And Dr. Shoureshi and I probably do more of this than anybody else in Orange County
yeah.
for sure. And so because of that, we've definitely had our experience and we've seen our success, and we want to bring it to other patients if they feel like they're a good candidate. So
Oh, I love the hearts and claps. You guys are so nice.
Wonderful. I love that too. So, and there's a couple of things that I want to make sure I do answer that. Have you guys addressed that last question is, do your patients see improvements after the 30 minutes in office sessions?
Yeah, so with those sessions, I think some patients can see results as soon as after like 6 or 7 patients, but most of them, it takes the full 12 to notice a difference. And usually what we do is we sign you up for the 12 sessions and then check back in after that. See what you're like, see if you're happy, and if you are, then you continue with those maintenance sessions, which are every like 3 to 4 weeks moving forward.
Perfect. So there was a question that was saying they want to share this with their friend, and that makes me so excited that they valued the information that you guys are giving and they want to share it with someone. Yes, there will be a link that will be provided if you registered, and clearly you did because you're here with us, but there will be a webinar link sent to you if you want to share or rewatch the video for further information, or perhaps just listen to it another time to gather more information. So yes, there will be a link that's been sent out, and our providers will have this link available for them. And again, if you want to schedule an appointment for a consultation and get more information to talk personally about what you may be struggling with, our doctors are available to do that for you. As you can see, the screen does have their number to make appointments. And again, take some time, talk with our patient ambassadors about how they've overcome this and how their lives have improved. So with that being said, I'd like to thank you so much for joining us this evening. Our doctors have given their closing statements, and at this time, we are going to end our webinar. We do thank you and value for your time, and hopefully this is something that you'll be benefiting from going forward. Thank you again, doctors.
thank you. Good night.